Hello, ladies and gentlemen of our nation. My name is Cara Lynn Warren, and I am the head of the Federal Emergency Management Agency, known as FEMA. I am addressing the nation today to discuss the growing concerns about the state of emergency declared in 21 states. These states are Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. Last September, all the states I listed received influenza shots from the Acme Medical Research Corporation, AMRC. It has recently been discovered that half of the vaccines distributed mutate upon contact with the body's T cells within 30 days of injection. The initial symptoms of exposure to the mutant vaccine are flu-like symptoms, including vomiting, high fever, and/or headache. Unfortunately, within 3 to 5 days of the initial symptoms, the mutations attack the nervous system, resulting in paralysis and/or death. If you or anyone you know received a flu vaccine between September 1st and December 15th, it is urgent that you contact the Center of Disease Control immediately for medical assistance. With 75% of the vaccines already distributed before the recall, the situation has been declared a state of emergency. The current death toll is over 50,000, and those affected number in the hundreds of thousands. FEMA is working with the CDC and the FDA, the Office of Public Health Emergency Preparedness and Response, the Health Resource and Service Administration, and the Department of Homeland Security, who is currently implementing both the National Disaster Medical System and the Metropolitan Medical Response System to assist us further with this situation. Both local, state agencies, and private companies are also cooperating with us to help all those affected by this disaster in receiving the necessary medical assistance. The DMAT is further assisting us in the disaster by sending in medical reinforcement in the form of disaster medical teams from other states not affected. The remaining 25% of the vaccines have been turned into the CDC for full analysis before destruction. As of yet, we do not have a drug to counteract the mutated vaccine. However, the CDC is currently working around the clock to create a suitable counter vaccine to the mutated vaccine. As soon as the counter agent has been created, we are ready to disperse it to the affected states. Currently, the causation of the mutation is yet to be determined, and bioterrorism has yet to be ruled out. The National Bureau of Investigations is conducting a thorough ongoing investigation into the mutated vaccine, with full assistance and cooperation from the National Incident Management System and the CDC. The NBI is not only investigating the Acme Corporation, but also into the FDA and the CBRE, Center of Biological Evaluation and Research, and the other agencies involved with approving and distributing this vaccine to the public. After evaluating the request from the governors in the affected states and with approval from the White House, I had the Health Resource and Service Administration release state funds allocated for recovery to all states affected. As the head of FEMA, I want to assure the people of our nation that we will continue to assist all those affected in every state to the best of our abilities until such time that the state of emergency is over. All families already hurt by loss or sickness because of this travesty have not only my deepest condolences and sympathies, but also my word that I will do everything in my power to make sure all of your families have the needed resources to assist in recovery and rehabilitation. Also, my word that we will make sure that the causation of the mutation is found and the responsible parties are held liable for the contributing roles in this disaster. Thank you.